conference is really an attempt to bring that knowledge to the general public and to enter into a dialogue with you all, and we have people online as well, about this issue, because it really touches everyone, and I think you're going to see through the talks this morning that it really touches everyone. And the speakers that you see, some of them are related to the project, others are not, but touch on important topics. And all of you here and online are part of that discussion. So one of the key aims is to get engaged in that dialogue. So we let told speakers to keep the jargon to a minimum, and also to leave enough time for discussion, because that's very important. I think looking at the registrations, we have people from the school system, we have coaches, we have players here, we have parents. So we have a broad range of people attending. First of all, I want to thank all of you for coming. I want to thank the sponsors to making this possible. Certainly St. Mike's has been very supportive. This is sponsored by the Canadian Institute for Health Research and the Ontario Trauma Foundation. This year, I want to give special thanks to the Legal Printing, who printed all the materials, and to the Full Media Center, especially to Justin and Ivan, who did a lot of the branding, did basically all of the branding, and the website, and they're doing the video, so they're doing the live streaming, and they're also going to have this up on YouTube and on the website. So people who couldn't come today, going to look at it or present it to the people that you're working with, say a hockey team or a set of teachers or coaches, and you can pick out a specific aspect of YouTube. So that should be ready in a few weeks, I think. I want to thank everybody for that. So the morning's going to run sort of like this. I'll do a little introduction about concussions across all sports. And then we have Bob Mann from the Center for Addiction and Mental Health. He's going to talk about substances and alcohol use in adolescents who've had brain injuries. Gabriella Ilya is going to talk about mental health issues. And then we'll have a break. And then Jane Toplovic-Brannick, who's a neuroscientist here at St. Mike's, is going to give a little bit of an anatomy lesson and show how mental health issues relate to brain injury. Donna Octoloni is the head of the head injury clinic here, and she is going to share some of the symptoms that people come with. And then one of the key things this morning that we want to talk about is the whole issue of stigma around mental health issues related to concussion. We're fortunate that we have Shrika Bellarao here. He's a psychiatrist and neuropsychiatrist. He's done a lot of work in this area, and he's been trying to translate that to the general public, and he's put together a nice documentary. I think we're just going to see the trailer on that documentary, but it should be a nice springboard for discussion. And then we're fortunate that we have Max Taylor here, who's a professional hockey player. He's going to tell us about his experience with concussions. And then we have a panel discussion, and each of the talks will have ample time for discussion. So I want to encourage you, we have mobile mics along the sides. Feel free to step up to one of the mics, or if you raise your hand, someone will come and give you a mic. We have some of our students here, and they'll bring you a mic. Just one other point is the bathrooms are just out near the registration area to the main lobby to your left, and we want some feedback from you. So if you can contribute feedback forms with your handouts, so please feel free to fill those in and share that with us, because we do actually look for the topics for next year's conference there. So I'm going to start with this presentation where we looked at mechanisms of head injuries or concussions across several of the commonest team sports that we have in Canada. And I want to recognize the students and the people, Steve McCall and Min Do from the Public Health Agency of Canada as well. this study. So it's very clear that these injuries are very common. In the U.S., there's estimates from 1 million to 1.5 million of these injuries will occur every year. Some of them can have devastating consequences. As a result, in the U.S., they've developed laws around education, around concussion. This was around a devastating case in a teenager who was playing high school football and went back to play despite being injured with a concussion and suffered permanent consequences. So these can have permanent consequences if they're not recognized that the child or youth is put back to play. So our intention really is to highlight some of these issues and to minimize the risk and keep kids in activities. Most of the research has been around hockey and football for obvious reasons in North America, but we lack information about the actual mechanisms. This paper, if you want more details, is online. If you just Google FOS1, put in mechanism of acute sport-related brain injury or brain, it should come up. So it's all online for if you want to get into the details of it. So we looked at effects of age, injury, sex issue, girl versus boy, and then different team sports. Now, what we did in this study is that we used a system called the Canadian Hospitals Injury Reporting and Prevention Program, or SHIRP for short. What this is it's an amalgamation of 15 hospitals across Canada who have agreed to record information when somebody comes into the emergency room. They give a parent or a person a questionnaire about how the injury occurred. And so this is pretty representative across the country. It's 15 hospitals. There are 11 pediatric hospitals and 4 adult hospitals that are involved. And we look at these sports, so ice hockey, soccer, football, basketball, baseball, and rugby. We actually looked at a few more, but there were small numbers in the other sports, so we didn't report on those. And we looked at whether they were injured in an organized setting or in an informal setting, whether it occurred urban or rural as well. So we looked at a number of different things. So what we actually had to do is a number of our students actually looked through all the records from these hospitals. And we had to code all the records. So it was painstaking. It took quite a while. It's almost 13,000 records that the students looked through. We had to classify the kinds of injury as to whether they were collided or contact with another player, whether they were things like falls, whether they were hit by the playing device, like whether it's a ball or a puck, whether they were hit by the implement, like a bat or a hockey stick, whether they hit something in the environment, like a goalpost. So we coded 12,799 brain injuries related to sports, and we looked at the 5 to 19-year-old age group. And these account for about 16.2% of the injuries insured. And not surprisingly, 81% were in boys. Average age was 13 and a half years old. Most of them were in urban areas. 3/4 of them were in urban sports, more than sports. So let's look at some of the numbers. Hockey was the commonest one that presented. There were more than 5,000 kids who were injured in hockey. And what you can see here is a different mechanisms. So here's a 5 to 9-year-old age group, 10 to 14, and 15 to 19. And here's a color coding scheme. So blue is contact with another player. Okay? And so in the 5 to 9 age group, you can see the boys' injuries and the girls' injuries. And you can see that contact is a major mechanism, even in 5 to 9. And as you get older, it's 15 to 19 grows. These are the other mechanisms. So falls. So falls are occurring in the younger kids much more commonly. a stick, collision with an obstacle, or other. So, I mentioned the first point, that a collision with other players is common. We see that checking into the boards is a major mechanism, and still, even though we have rules against checking from behind, we can see that up to 10% of kids are still getting injured from checks from behind. And this is despite all the work that we've done around this. So that raises some issues about rules and how we're enforcing them and how kids are interpreting them. The falls in the younger kids would suggest protective equipment onto those kids and teach them proper technique of skating. Now soccer. Soccer is now the commonest sport in terms of registrations in Canada, and we have 2,400 kids who have brain injuries in soccer. If you look at the collision aspect, you can see the same trend here, that as they get older, we get more injuries related to collision. And an interesting point that hasn't been raised very much is that kicks to the head also increase. And as you get into the teenage groups, again, about 10% of these are kicks to the head, and there are already rules against that. A lot of mechanisms player to player, elbows and head to head as well. An interesting point is that in the younger children, there were about 150 of these that they sustained their brain injury by running into an obstacle in an environment that was usually a goalpost. So we could change that pretty quickly by changing that environmental hazard for young kids, so we have goalposts that move or pattern. Move on to football. Football has some of the similar mechanisms, tackling being a major mechanism. You can see it in the younger kids, it's pretty rare, but as you get older, it's more common. And then, same thing we saw in soccer, that the younger kids are running into goalposts. It's something that we can do something about. Basketball, about 1,500 kids as well. We can see here the same pattern, even though we don't think of basketball as a sport like that. We can see player-to-player contact increasing as the child gets older. These are usually elbows. You can see the numbers there. Baseball. Baseball has a different pattern. Not surprisingly, we had about 800 kids injured here. And you can see in baseball, being hit by the ball is a major mechanism, and that increases as the child gets older. Another point is being hit by the bat. Especially young kids, a surprisingly large number of kids getting hit by the bat. This is the comments were usually they were standing too close or they weren't supervised. And a large proportion of these were unorganized sports too. So a kid gets a bat in the backyard or the schoolyard, and nobody's supervising them, and they're not wearing harness, and they take a bat to the head. So you can see in that young age group, it's about a quarter of kids are getting hurt that way. Rugby, fewer numbers in rugby, about 700, but similar to the player-to-player contact. And you can see almost all of them in the teenage groups are due to that. So these, I've mentioned some of the things that we could look at in terms of preventing these. In hockey, certainly we have the rules that are already there about checking from behind, checking into the boards. Soccer, kicks to the head and goalposts. Football, tackling issues. Basketball, baseball, I think we could make a big impact in baseball pretty quickly, and that hasn't been studied much at all. And then rugby. So, for example, I mentioned this already, adding on goalposts, we change the way the environment exists so that we don't have to do anything active with the players, things like supervision and helmets in baseball. Now, I think I didn't point it out, but all the mechanisms were similar in boys and girls. And they were similar whether kids were wearing a helmet or not. So we need to think about the mechanisms that are occurring and then deal with issues about the environment, about rules, how the sports are played, and education. Yeah.
Should I stand up?
Just wait until there's a mic, because we're online too, so people online can hear you.
Hello, my name is Jabir, and my question was regarding the study on soccer. Did you look into this situation where the head injuries occur the most at head-to-head or kicks to the head? Because I know I play soccer, and set pieces are always like the most nerve-wracking, especially corner kicks.
Right.
Because there's 11 players in the box.
Yeah,
It's a lot easier to get a head, elbow to the head or kick to the head.
that's
So
right.
I was wondering if you guys were able to discern that.
Yeah.
Understand.
That was the commonest mechanism for player-to-player contact is elbows and head-to-head. People would both go up for a header and they would hit each other.
In the description, did it say this occurred during a corner kick or just a regular?
They didn't always say what the play was that where it led to that head. So we didn't really make comments on that because we wanted to get information where it was pretty consistent all across, say, the 2,400 players. And so there was a lot of missing information. We didn't record that. But having said that, we're doing a more detailed study this year to look into some of those questions in a little more detail.
Thank you.
Another question here. Just, can everyone hear at the back? Yeah.
Anne Richards, being a pediatrician. Did you have a sense of how protective helmets were in this group? What percentage were wearing helmets, what weren't? And secondly, the appropriateness of the fit of the helmet. I say that because I see children on bikes with the helmet kind of slung back like a scarf.
Yeah, that was in the focus of this study. It's a good question about helmets and whether children wear them properly. We just published a paper this week, actually, on helmet use in young children in kindergarten at that age group. And it's clear that an improperly worn helmet for this situation of bicycles is actually useless. And so if you do see kids that are riding down the street, and often it's with their parents, and the helmet's like way up here, I often stop them and will say, this is the proper way. And we've actually put a handout in your little handouts about the 2V1 rules. So the helmet shouldn't be more than 2 finger breadths above the eyebrow. The strap should be V around the ear. There shouldn't be more than 1 finger on the strap underneath. And this paper shows that we can teach children in kindergarten to do that, and they wear the helmet properly. Clearly, helmets are part of the solution, but they're not the whole solution in these team sports. But things like baseball, especially informally, I think we could make some impact if we encourage parents to, when they buy a baseball bat, that they also buy the helmet, especially young kids are supervised. Another question there?
Hi, my name is Jamie. I suffered a brain injury in 2007. I was wearing a helmet, and that's where my question stands. I read a lot of articles that helmets don't necessarily prevent concussion. They're more focused on preventing massive head trauma. Has there been more research into getting helmets that are looking to prevent concussion opposed to just traumatic head injury?
Well, the prevention of the more serious injury like skull fractures or brain contusions or hemorrhages in the brain is still a worthwhile goal. So no one would say for hockey players to take off their helmets again. But there are a number of engineering labs around the world that are trying to develop helmets to prevent concussion, but we're not there yet. But there's a tremendous amount of interest to do this. And so people are working on it, but I don't think we're there yet.
Dr. Cusimano. I know CHIRP data covers those who are in hospital. Is there any way to study, or did you get any sense of who you're not capturing in this data and who you're not presenting in hospital but does have an injury?
Yeah, that's a good question. So CHIRP only captures people who attend to an emergency department. So we're missing people who just will go to their family doctor or their pediatrician, or they'll just stay home with a headache for a few days and not seek medical attention. So we're missing that huge group. That's a huge number of people that we're missing in CHIRP alone. And we're missing the people who died. So that's unfortunately a very small number, but that big number at the bottom we're missing. So you're going to hear later in the next talks in a different way to capture that group. And some of that work is actually not been done before. So it's really exciting to understand how big that group is. And you're going to hear the numbers. So I'm not going to say anything more about the numbers. Those researchers are going to let you know about those numbers. But that is a limitation for sure. Okay, that's all the questions. Yeah, one other question?
I see.
Just wave if I don't see you or someone doesn't see you, just wave or jump up and down and we'll get you, okay?
Yeah, so I see that a lot of the mechanism of injury that you mentioned was contact with the players.
Yeah.
So whether it be intentional or not intentional, do you think that providing education on smart strategy, play, maybe just smart strategy overall, do you think that that will help influence seeing less contact, do you think, that causes that injuries? Like, what's the feasibility of education?
Education is key. Education is a glue that brings everything else together. Okay, so if you introduce, say, a new rule, whether it's in soccer or you already have a rule, say, in hockey about getting behind, education is key. So I don't think, when I raised this, a lot of the hockey people said, no, hitting from behind doesn't exist anymore. No one's getting injured because we have rules against it. So there we need to educate people and raise awareness that in fact people are still getting hurt and that we need to do something. So I think education plays a key role. It's not the only way of doing things, because that alone is probably insufficient. We won't get to a reduction in injuries as much if we just educate people as if we were to say change rules or change the environment and educate them together. So it's critical, and but it's not sufficient in itself, I think. And the research that we looked at all the mechanisms in rugby a few years ago, one of our students, I think is here, he looked at all the studies about rugby. Education itself was much more effective when they introduced it across the country in New Zealand and Australia with changes in rules about the scrum and different things. So it's key, but it's not sufficient itself. Okay, so I think we'll move on to the next talk.